Good evening, everybody, and welcome to third week here at the Oxford Union for our third debate of the term. This House believes the NHS is the envy of the world. And our first speaker and proposition is the Oxford Union's grandly titled Chief of Staff, Arjun Bhardwaj, to propose the motion.
Good evening, everyone. I would like to begin by thanking the President for hosting a debate on such an important topic and for giving me the opportunity to speak on the motion. It has been a pleasure working with you, Mr. President, and I would like to congratulate you on a very impressive term card. At a time when healthcare systems all around the world have come under immense pressure and are facing huge public scrutiny, the motion before the House has never been more relevant. Tonight, I will attempt to not only praise the NHS, but to assert it as one of the best healthcare systems in the world, one which other countries should be envious of. My argument tonight has two main strands. I will first look at the importance of a free at the point of use healthcare system and the tangible benefits it brings to this country. Although this may seem like a simple point, it is one that we simply cannot afford to take for granted. Across the Atlantic, you'll remember, the story is very different indeed. Even before the outbreak of the pandemic, a quarter of Americans said that they, or someone they knew, had delayed serious medical treatment due to the extortionate cost of care. We should be truly fortunate to consider that we are not in such a predicament. My second argument discusses the NHS's vaccine rollout, which the rest of the world is certainly envious of. In administering over 10 million doses already, the NHS is leading Europe, North America, and Asia in the race to vaccinate their population. Others are struggling with their vaccine rollout. One just needs to look at the European Union's unethical and panicked triggering of Article 16 as proof. Tying this back in with my opening point, I would argue that the world is envious of the NHS's capability to administer the vaccine so efficiently and for free at the point of injection. Before exploring these arguments in further detail, it falls upon me to introduce the opposition speakers. Opening the case for the opposition is Daniel Paul Osahon, a second-year medic at Balliol College. Daniel Paul is currently on the Secretaries Committee at the Oxford Union and worked incredibly hard to help produce our term card. As a medic at Boris Johnson's old college, it is no surprise that Daniel Paul is speaking against the motion tonight. I look forward to seeing him selling his talents to Harley Street rather than represent the NHS. Following Daniel Paul, you will hear from Christian Niemitz, currently the head of political economy at the Institute of Economic Affairs. Christian was previously a specialist in health and welfare. For those of you who don't know, Christian has a cult following on Twitter, frequently changing the name of his account. He apparently once named his profile, Christian Niemitz has sold the NHS to Donald Trump. I hope he does not advocate for this tonight. Matthew Lesh will be the next to oppose the motion. Matthew is the head of research at the Adam Smith Institute and a frequent writer for The Telegraph. I'm sure Matthew will present some compelling views tonight, ones which I hope are not influenced by funding from the tobacco industry. Finally, Kate Andrews will conclude the debate. Kate is the economics correspondent for The Spectator and host of the podcast series Coronomics. Her appearance on Newsnight in 2018 caused quite a stir when she advocated for an overhaul of the NHS on the eve of its 70th birthday. I hope for an equally controversial speech tonight. Mr. President, these are your guests and they are most welcome. In opening the case with the proposition, it is my duty to emphasise the importance of free at the point of use healthcare. This point has never been so relevant. At a time when a global pandemic rampages throughout the world, it is easy for us in this country to take the NHS for granted. Indeed, we seem to become immune, pardon the pun, to the advantages of free at the point of use healthcare. Should your access to basic medical treatment depend on your wealth? If education is seen to be a right and gladly funded by the state, so too should medical treatment, which intuitively seems to be an even more basic right to life. Even if one advocates for a theoretical, libertarian, minimal state, how can one have any sort of liberty if they can't afford access to medical treatment? Not being able to receive physical treatment and sustain yourself is clearly a blatant denial of Nazikian self-ownership. Accordingly, I would therefore argue that anyone in society ought to have access to free at the point of use healthcare. We have to remember that the NHS was set up as a manifestation of this, and to this day, it excels in providing easy access to world-class healthcare treatment for all members of society. This, in my opinion, is certainly worth applauding. Other countries have failed to deliver on such promises. In France, you now have to pay 30% of the cost to visit a GP, and in most Australian states, you have to pay a substantial fee just to call an ambulance. One just needs to look at the United States for a very different picture. A study by America's health insurance plans worked out that the average cost to treat a patient hospitalized by COVID-19 was over $30,000. Even if you are insured, with plans being notoriously expensive, it is unlikely that your healthcare provider would cover the full cost. Accordingly, a poll found that 1 in 7 Americans would not seek medical care for coronavirus due to the cost of treatment. We are truly fortunate that we do not have to live in fear of illness for the financial strings attached. Therefore, one should not underestimate the importance and value that the NHS provides in offering free at the point of use medical treatment to all. My second and main argument tonight revolves around the NHS's impressive work in rolling out the COVID-19 vaccine. Remarkably, the NHS has already administered over 10 million doses, which accounts for 15% of the UK. Only 3 countries have administered more doses per capita, all of which, perhaps coincidentally, have free healthcare systems. So what has made the rollout so successful? The success, I believe, can be broken down into 2 parts. First, we must acknowledge that the role the government has played in acting efficiently to vaccinate the country. The government acted quickly to sign in-principle agreements with 4 vaccine producers and had an action plan of who to vaccinate first ready to go. By ordering over 400 million doses of the vaccine, the government has ensured that everyone will eventually have access to the vaccine and have covered themselves in case of any supply issues from one of the producers. Second, but more importantly, I would argue, is that we have to praise the NHS for being able to handle the logistical nightmare that mass vaccination causes. The NHS have excelled in both the simple tasks and the more complex processes. For example, by actively writing to and calling those eligible for the vaccine, the NHS have ensured that those most at risk can easily find out the date and time of when their vaccination is due. While we may simply take this for granted and assume it is a straightforward task, it stands in contrast to Germany, whose online booking system encountered numerous problems when it was first launched. In addition to this, the NHS have fewer barriers to vaccine than other countries. In France, high-risk patients have to visit their GP at least 5 days before taking the vaccine. This is surely not practical at a time of a national lockdown, especially with those who are seeking the vaccine first being the most vulnerable. By adopting a pragmatic middle ground, the NHS has succeeded in rolling out the vaccine quickly, while still ensuring that those who need it most have first access. On a larger scale, by having a single national health service, it paves the way for coordinated mass efforts. By pooling together all of the nation's resources, the NHS were able to lay out clear national targets and work clearly and efficiently towards meeting them. This would not be possible in a decentralized, privatized model. One of these sort of targets was focusing on care homes. Throughout the pandemic, it has been care home residents who have suffered the worst. In response to this, the NHS were able to identify this as a major area to address, and accordingly have now managed to offer the jab to every care home in England. This was only possible due to the large-scale coordination that the National Health Service is available to provide. So to conclude, envy can be a fleeting emotion, but at this time, I'm sure many other countries are truly envious of the NHS. In providing free at the point of use healthcare to all, the NHS allows all members of society, irrespective of wealth, to the basic right of healthcare. In addition to this, the NHS is truly leading the world in terms of the vaccine rollout. By working efficiently, the NHS identified those most vulnerable and have done everything to protect them and prioritise them. For these 2 reasons, I urge you to vote in favour of the motion tonight. Thank you.
Thank you very much, Arjun, and thank you for all the hard work that you've done in this term card this term. It's a pity that members don't get to see all the hard work that gets done behind the screen. So thank you very much for all this. And equally, someone who's done an awful lot of work as well now to open the case for the opposition is member of Secretary's Committee, Daniel Paul Osahon, to open the opposition.
Thank you, Mr. President. Paul Richards was a fit and healthy man diagnosed with non-Hodgkin's lymphoma in 2007, and he was being treated through chemotherapy. On July 22nd, 2007, Paul and another patient, Baljit Singh, were killed through the administration of lethal overdoses of amphotericin, a commonly used, highly toxic antifungal drug. In November 2008, James Titcom's 9-day-old son died as a direct result of poor care, as it took years to expose the major problems in patient management and regulation. The 2015 Keir report revealed that 11 babies and a mother suffered avoidable deaths within that same Morecambe Bay NHS Foundation Trust. The report showed the trust refused to learn and adapt after each case. This is reflective of our 72-year-old health system as is failing to match the standards of its continental counterparts. Before I begin, I would like to clarify this motion you are being asked to vote on tonight. It is not the question of whether the NHS is good or even great. We all appreciate the peace provided by the beverage model, allowing us to dismiss the affordability of treatment when considering our own healthcare. I concede that the NHS shines on access, care coordination, and patient involvement, but this motion goes way beyond this. This motion tells us that the NHS is the very best in the world. And I must remind you that the burden of proof is on the proposition to demonstrate this, and I can assure you that they will fail in that endeavour. The falsity that the National Health Service in its entirety garners admiration and envy from the rest of the world is absurd. Both qualitative and quantitative analysis of the NHS shows mediocre, if not poor, performance in critical measures like the equity of healthcare and patient outcomes. Before I take you further into my argument, it falls on me tonight to introduce the members of the opposition. Opening the debate, we just heard our very own Chief of Staff, Arjun Bardwaj, studying classics at Corpus Christi College. He is generous and thoughtful, working hard to manage the inner workings of the union. He's put in a huge shift to produce this current and previous term cards, and he is continuing in the tradition of Old Westminster's dominance at the union. The Right Honourable Jeremy Hunt, MP, is a distinguished politician with the record as the longest serving Secretary of State for Health, serving from 2012 to 2018. He then served as the Secretary of State for Foreign and Commonwealth Affairs from 2018 to 2019, and he is currently the chair of the Health and Social Care Select Committee, as well as an MP for South West Surrey. He is a truly distinguished man. Sir David Nicholson is an accomplished civil servant, serving as the Chief Executive of the NHS from 2006 to 2014. He is the current chair of the Worcestershire Acute Hospitals NHS Trust, and his passion for the NHS saw many reforms that helped the ageing system, and he was instrumental in the structural changes in the NHS over the last 10 years. Finally, Dr. Amir Khan is an influential general practitioner, TV doctor, and senior university lecturer at Leeds and Bradford University. He's also a published author. His beautifully written book, The Doctor Will See You Now, The Highs and Lows of My Life as an NHS GP, is a must-read for aspiring medical students and anyone wishing to get to grips with the realities of the NHS. Let's hope his COVID jabs are better than his namesake's boxing record. I am sure our ageing president will appreciate having a doctor in the house, albeit virtually. Mr. President, these are the opposition speakers and they're most welcome. There are many aspects of the NHS that completely disqualify it from holding the title as best in the world. As an opposition, we will show you today that the NHS has much to learn from abroad. My case is simple and is summarised in 3 points. Firstly, the NHS has mediocre, if not poor, health outcomes when compared with the healthcare systems of similarly positioned nations. Secondly, the NHS routinely fails its Black and minority ethnic staff, as well as BAME patients, an issue that has been especially clear during the pandemic. Finally, analysis of international healthcare systems has found the NHS to score mid-table, with the Bismarck system of universal healthcare insurance consistently outperforming our beverage model funded by tax revenue. None of this is worthy of envy, let alone the title of best. The extreme examples I used earlier illustrate poor patient care, with doctors and nurses constrained by the NHS system, forcing them to act outside of their care instincts. Malpractice claims against the NHS have doubled, especially in cases involving newborns, with payouts growing from £580 million in 2008 to £1.4 billion in 2016. While the NHS provides good financial protection from ill health, the treatment provided by the NHS is worse than average. The proposition will undoubtedly reference the Commonwealth Fund study that complements the NHS, but it highlights that health outcomes within the system are worse than average. For 8 out of 12 of the leading causes of death, including many cancers, the NHS performs worse than its counterparts. The 5-year relative survival rates for cancer are especially low in comparison to other nations. In the study, the UK ranked second to last for healthcare outcomes, only beaten by the United States. What terrifies me most is that the NHS scores consistently poorly on amenable mortality. That is death that could be avoided by medical treatment. In a group of 19 similarly positioned countries, the UK ranks 17th on medically avoidable death. This flies in the face of the medical ethics tenets of beneficence and non-maleficence in medical treatment. Within Europe, the NHS is also poor on this measure. It performs 14% worse than average and almost 50% worse than France. Infant mortality in the UK is 27% higher than this group of 19 countries. The NHS also faces a huge problem with nosocomial infections, namely healthcare-associated infections, and it is particularly plagued by antibacterial resistant infections such as MRSA and C. diff. 6.4% of inpatients acquire healthcare-related infections. This has been particularly prevalent in COVID-19, where up to 20% of patients have acquired the disease whilst in hospital. The poor healthcare outcomes in the NHS are nothing to envy. For the most part, fatal illnesses like cardiovascular disease and stroke, the NHS consistently performs below average. Secondly, the NHS fails its Black and minority ethnic staff and patients. The NHS has recognised that there are race evident inequalities in healthcare. Asian and Asian British patients were 20% less likely to give a positive response to the question of whether they were treated with respect and dignity during treatment, in comparison to white British patients. And Chinese patients were 50% less likely to give a positive response to the same question posed in emergency wards. Young Black men are 6 times as likely as young white men to be sectioned for compulsory treatment under the Mental Health Act. And these inequalities continue to the treatment of staff within the NHS trusts. There is a lower proportion of BME staff in non-clinical senior positions compared to their local areas, and disproportionately high numbers of BME staff face disciplinary action. In fact, they're twice as likely to be disciplined compared to their white counterparts. These issues concentrate as you climb the NHS hierarchy. Within the NHS, nearly 18% of staff are BME, and only 8% of its senior managers are BME. Roughly 15% of the service is provided by BME staff. However, 92% of the board members of the NHS are white. In fact, 45% of NHS provider boards had no BME members as of 2011. And it seems as if the NHS is uninterested in addressing these issues. A web audit in 2010 found that only 80 of the 223 trusts published any ethnicity data. During the pandemic, it was clear that BME people were being disproportionately affected, yet it took a long while for the NHS and public health systems to investigate this and bring about safeguards for staff. Can we really say that such a service is worthy of global admiration? Finally, the NHS is not the only option for free at the point of service healthcare. The best healthcare systems in the world do not look like the NHS. I believe in performance-based assessment. It's the outcomes of healthcare, patient experience, and the health of a nation that quantifies a healthcare system. One may argue that the NHS treatment outcomes are marred by an already unhealthy society, but we have had a generation of the NHS. We should see a remarkably healthy population by now. That the UK is one of the unhealthiest nations amongst its contemporaries. We have a lower life expectancy than the average G7 nation. And the Bloomberg Global Health Index placed us at number 23 in terms of population health. This does not reflect the best healthcare system in the world. Universal health insurance systems subsidized by the government, such as the Swiss or German Bismarck models, are extremely effective and consistently outperform the NHS model, according to the 2017 European study and many of those studies in the years before. The UK most recently ranked 16th, while Switzerland topped the charts. To summarize, claiming that the NHS is the envy of the world is simply ludicrous. You'll be hard-pressed to find any G7 leaders pining over the NHS. I don't think Merkel and Macron, with their significantly better healthcare outcomes, are kept up at night awaiting an NHS-shaped saviour. As a medic myself, I do love the NHS, but to claim it is the envy of the world is to dishonour those staff and patients who have been mistreated by it. It does not embrace the criticism it desperately needs to truly fulfil its potential. I urge you, if you love the NHS as much as I do and want it to be successful for generations to come, you must vote down the propositions tonight and join me in seeing the NHS for what it really is, an outstanding concept, but desperately in need of improvement.
Daniel Paul, thank you very much for that. Never let it be said that the Oxford Union isn't the home of free speech when a medical student is so able to bite the hand that will probably feed him for at least a little bit. Thank you very much for that. And the next speaker now has been introduced to you is following in the long line of speakers so far this term as another one of my former bosses. I'd like to ask the Right Honourable Jeremy Hunt MP for his remarks.
Thank you very much indeed, Mr. President, and it's a pleasure to be introduced by you as someone who I know will go a very long way in public life. And thank you too for some excellent opening speeches by Arjun, very thoughtful comments about how the NHS works, both in principle and practice. And Daniel Paul, who I thought gave a superb speech, which, although I don't agree with his conclusions, gets to the heart of what we need to be discussing about the NHS. And as someone who I'm sure will make a very fine medic, he has also shown that he will make a very fine contribution to the debates we have about the future of the NHS. During the pandemic we're in the middle of really, the country has taken the NHS and care system right to its heart, as we should. But are we the envy of the world? I believe we are, but that doesn't mean there aren't many things that we can do much better. The fascinating thing about the NHS is that despite all the criticism you read about it in the papers, in poll after poll, the NHS is the institution the British public say makes them most proud to be British. Ahead of the royal family, ahead of the armed forces, ahead of the BBC, it is the NHS that is the thing that makes them feel most British and most proud to be British. Why is that? We were actually, when we set up the NHS in 1948, the 6th country in the world to set up a universal healthcare system. New Zealand was the first, but we were probably the first large country to do so. And when we took that big decision, we did something that spoke to our values as a country, that in this country, no matter who you are, rich, poor, young, old, city, countryside, north, south, every citizen has equal value, and you should never have to worry about your bank balance when it comes to healthcare. And those are views that are shared right the way across the political spectrum. The NHS was set up by a Labour government, but the idea of a National Health Service was first proposed by a Conservative Health Secretary, Sir Henry Willink, in 1944. And that ideal is most passionately of all shared by doctors and nurses on the front line, who consider it an absolute article of faith in their vocation that they should not have to worry if a patient can afford his or her care before they save their life. Unlike America, where nearly 30 million people don't have an insurance policy and don't have that security, and indeed unlike European insurance-based systems, where there is still a much bigger difference in the care received by rich and poor than there is in the UK. But that principle of universal health coverage has been adopted since 1948 by 3/4 of the countries in the United Nations. And the NHS has had enormous influence in making it part of the definition of a civilized, developed country, that you should have universal provision of health coverage. And that ultimately is why the NHS is the envy of the world, because it has helped to change the way the world feels about the right of every single human being on this planet to decent healthcare. And that is ultimately why you should support this motion. But just because we are the envy of the world, and this is where I actually agree with Daniel Poole, doesn't always mean that we are the best in the world or the highest quality in the world. And Daniel Poole's absolutely right to point out some of the things we do best. But I would point out all those scandals he talked about, the Morecambe Bay scandal, which I had to deal with the aftermath of when I was health secretary, the tragic death of Joshua Titcombe. We read about those because the NHS is by far the most transparent healthcare system in the world. And we publish more data by a long, long way than any other system. But it would be completely wrong to say these problems are unique to the NHS. In the NHS, around 4% of our hospital deaths are preventable. That's the same as Canada, Holland, New Zealand. In the United States, it's much higher, around 250,000 preventable deaths every year, according to Johns Hopkins University. But it is because we are more transparent and open about these issues that we are putting more of them right. And when I was health secretary, I introduced the Ofsted system for hospitals, which means every hospital is graded as outstanding, good, requires improvement, or inadequate based on the quality of its care. And as a result of that system, just in 4 years of having that system while I was health secretary, by the end of it, 3 million more patients every year were being treated in good or outstanding hospitals. And I profoundly believe with this focus on quality and safety, as well as access to care, the NHS really can become the safest, highest quality healthcare system in the world. And that has to be our mission. Now, I want to tackle head on what Daniel Poole said about the idea of moving to a European-style insurance-based system. And of course, what Daniel Poole didn't mention was that both France and Germany spend significantly more. France spends 1% more of its GDP on health, and Germany spends 2% more of its GDP on health. But I want to suggest that having faced the pandemic and having the prospect now of other pandemics in our lifetime, the NHS structures that we have shown themselves to be extremely effective in this national emergency, and this would be exactly the wrong time to change those structures. Let's look at some of those structures. First of all, the incredibly close collaboration between the NHS and the scientific community, which has meant that 400,000 people in the NHS have been enrolled in vaccine trials that have helped us become the country that not just discovered the Oxford AstraZeneca vaccine, which will probably turn out to be the vaccine that saves the most lives in the world because it doesn't have to be transported at low temperatures, but also discover the first treatment for COVID, dexamethasone. That collaboration is possible with the NHS structures we have. It's much harder when hospitals are owned by a multiplicity of private sector providers. Let's look at the fact that in the last year, however horrific that year has been, however horrific the death toll has been, and we certainly haven't got everything right as a country in our pandemic response, every patient that needed it so far has got a ventilator. Every patient that has needed it has got an intensive care bed. And part of that is because hospitals in an emergency in the NHS can act in a way that doesn't happen in other countries, which is they can just act as one organization. So we hear stories about patients being transferred all over the country in the pandemic to get an intensive care bed, as if that's a bad thing. But the strength of the NHS operating as one body has meant that everyone who's needed it has been able to find a bed, even if that's meant travel. And that did not happen in Lombardy in northern Italy. It did not happen in New York. And finally, look at the speed at which the Nightingale hospitals were set up. Again, because one national organisation, NHS England, had responsibility for hospital care and was able to make those decisions. Finally, of course, something that Arjun mentioned, the efficiency of the vaccine distribution, made possible because of the close links between hospitals and GP surgeries. Again, possible because we have a national health service, not a fragmented health service, as most other countries have. But if we want to be the safest, highest quality healthcare system in the world, even if dismantling the NHS right now will be completely wrong, reforming it would not. And we need to do three things now to really make sure that we are offering the highest quality care. Firstly is to sort out the social care system. And I think this is a chance for a Conservative government to do something as historic as the Labour government did in 1948, which is to make this the year of change for the social care system, as 1948 was the huge year for the NHS, with a long-term plan to sort out workforce issues, a long-term funding settlement, and reforms to make the treatment or the help we give to families with someone suffering from dementia or a neurological condition much fairer than it is at the moment. For the NHS, we need to finally sort out the workforce issues. When I was Health Secretary, I was proud to increase the doctor, nurse, and midwife training places by a quarter, one of the biggest ever increases. But it's still very haphazard and we still have workforce shortages. And we should ask the Office for National Statistics to publish every year what the NHS workforce need is for the next 5, 10, 15, 20 years to make sure we really are always training enough doctors and nurses. And finally, we need to work harder to make sure that having the highest quality of care is as much in the DNA of the NHS as delivering a high quantity of care. And that, of course, means the things that Daniel Paul was talking about, but particularly improving our cancer diagnosis so that we have cancer survival rates as good as France or Germany, which I'm absolutely sure we can do. So let me conclude, Mr. President, by saying, by quoting what Mahatma Gandhi said. He said, "The true measure of any society can be found in how it treats its most vulnerable members." This country blazed a trail with that in 1948, when we said that every single citizen is going to have access to decent healthcare. That made us the envy of the world. Now is the time to reclaim that mantle, to give the NHS and care system another 1948 moment, and show the British people that after this terrible year, the people's priorities are the government's priorities, and we will stop at nothing to make sure the NHS continues for many years to come to be the envy of the world. Thank you.
Jeremy, thank you very much for that. And thank you as well for providing more constructive feedback and advice to the government than the entire Labour front bench manages to do most days. Now, to continue the speech for the opposition, I'd like to ask Dr. Christian Niemetz.
Thank you, Mr. President, and good evening. I don't know where this envy of the world slogan comes from originally, but whatever its origins, it's one of the most bizarre acts of a collective self-delusion that I've ever come across. The NHS is not the envy of the world, of course, nowhere near it. The NHS is a third-rate healthcare system which produces some of the worst healthcare outcomes in the developed world, and it is envied by precisely nobody. Why would anyone want to envy the NHS? What would they envy it for? Of course, its proponents always point out that the NHS is there for everybody, treats everybody, rich or poor. And that's true. That's nothing to be sneered at. However, you could say the exact same thing about virtually every other healthcare system in the developed world as well. This is nothing special. This is the minimum that we should expect from a functioning healthcare system, and not something that we single out as a particularly outstanding achievement. There was an OECD report on this issue a couple of years ago now, where they tried to measure the percentage of the population in various countries that had guaranteed access to healthcare. And not just any healthcare, because obviously everybody can get some healthcare, but they looked at a broad package of healthcare services, which included primary care, hospital care, specialist services, diagnostics, pharmaceuticals. So a very comprehensive definition, a very comprehensive package of healthcare, and then figured out the percentage of the population in various countries with access to that. And well, the short summary is it's probably the most boring report they've ever produced, because there was so little variation between countries. It was just either literally 100% or very close to 100%, because in some places temporary residents don't have to sign up. But for all intents and purposes, it was universal pretty much everywhere. So the main piece of output of that report was literally just a list where they said in alphabetical order: Australia, 100%. Austria, 100%. Belgium, 100%. Canada, 100%. So it was only the US, which was really the major outlier here. There it was about 85%. This was before Obamacare. And yes, of course, that's a major policy failure. But the US was also the only country, the only rich country which had that problem. And therefore, I would say, yes, of course, we can endlessly bang on about this one outlier and then be smug and self-congratulatory about it. But I don't see what we are achieving in that way. Now, if you want to see variation in healthcare, international variation, what you have to look at is outcome measures. You have to look at measures like survival rates for the most common types of cancer, survival rates for strokes and heart attacks, survival rates for respiratory illnesses, measures of avoidable deaths, and things of that sort. Healthcare outcome measures. That's what you have to look at. And if you look at healthcare systems in those terms, it's not quite clear which system is the best. There is no system that comes out as unambiguously superior to all the others in every respect. So I don't think there is any system that I would describe as the envy of the world. There are probably multiple competing envies of the world, but at least there are several systems about which you could plausibly make that claim. So if the proposition was the Israeli system is the envy of the world, or the Swiss system, or the German system, or the Australian, or the Japanese, or the Taiwanese system, then I'd say all of those would still be hugely contestable, but they are not self-evidently absurd. Those are claims that you can make and that you can make a good case for. The NHS, however, is clearly not one of those systems. It's not even in the top 10, and it's not even in the top 20. If you look at outcome measures, you will almost always find the NHS being a below average performer among rich countries, and usually somewhere in the bottom third, quite often about on a par with Poland and the Czech Republic. So on outcome measures, the UK is a Western European country with Eastern European health outcomes. I don't see how that makes you the envy of the world, doesn't even make you the envy of Europe. And I know some of you are probably now screaming at your screens saying, yes, but that's just because of underfunding. It's just because it's been deliberately defunded. It's all because of austerity. It's because it's been sabotaged and set up to fail. But even here, if you look at healthcare spending figures in the year before the pandemic, now it's obviously skewed, but if you look at 2019, we were spending just over 10% of GDP on healthcare. That's mostly NHS, about 8% of that is public spending, plus some private spending. And those are perfectly normal figures in an OECD comparison. That's almost exactly the same as in Belgium, as in the Netherlands, as in some of the neighbor countries. Yes, some spent more, some spent less, but it's a perfectly average figure, nothing special, and that is clearly not the reason for the NHS's underperformance. And more importantly, when I say the NHS is usually in the bottom third of outcomes, I'm not talking about something that has happened in the last 2 or 3 or 4 or 5 years. I'm not talking about a particular government or particular health secretary here or particular chief executive of the NHS. I'm talking about long-term problems. You can look at figures from 10 years ago, 20 years ago, as far back as you can find figures, and you will always find this pattern that the NHS is usually behind its peers. And therefore, I was not surprised that during the pandemic, the NHS hasn't covered itself in glory. Yes, it's true. The vaccine rollout so far has been exceptionally fast, and that's great. No argument from me here on that. That's I'm happy to acknowledge that point. That's so far that's a success story. But nonetheless, if you look at the excess mortality figures up to this point, from March last year to today, we have again one of the highest figures in the world, one of the highest excess death rates in the world. That is, of course, not specifically the fault of the NHS. That has more to do with the overall response to the pandemic, the overall government response. It's not something that you can specifically single out a healthcare system for, but at the very least, it's not a reason to believe that the NHS is in any way the envy of the world or the envy of anyone. So taken together, some of the worst outcomes in the developed world. Access, yes, high, but is also high everywhere, almost everywhere else. Only one outlier, which is the US, so nothing to write home about. It clearly isn't the envy of the world, and I would ask you to vote, therefore, accordingly. Thank you.
Dankeschön, Herr Doctor. I can't tell you how grateful I am that you've taken some time off from trolling commies on Twitter to come and join us for this debate tonight. To continue the case now for the proposition, I'd like to ask David Nicholson to make his remarks. Thank you so much.
So thanks very much for the opportunity to speak in this debate, supporting completely the motion that the NHS is the envy of the world. And what we talk about there is the world, not just the OEDC, but the world. And I want to take you back to the summer of 2012, the day after the opening ceremony of the Olympics. And I was walking into the Queen Elizabeth Conference Centre together with the Prime Minister at that time, David Cameron, and the Secretary of State at that time, to meet 50, more than 50 actually, ministers of health from around the world who'd been at the opening ceremony. And we walked into a standing ovation. Now, I'm not silly enough to believe that the standing ovation was for me, nor even, do I say, that it was a standing ovation for David Cameron. But after that conversation that we'd had with them, it became very clear that they were absolutely overwhelmed by the way in which our healthcare system had been depicted in such an important international event. And they were very envious of that. None of them believed that their healthcare system would be held in such high regard by the people of their country. Now, part of that was around what people thought about it, but also thinking very carefully about what the implications of that mean. So I've worked in 20 different countries now over the last 7 or 8 years, helping governments develop universal healthcare. And as you know, 136 countries around the world now have signed up to delivering universal health coverage by 2030. And what is clear is none of them believe, and I certainly don't believe, that you can take a healthcare system from one country and implant it on another. The healthcare system a country has grows out of the history, the community, the way in which the culture of that system operates. But you can learn things. You can look to other healthcare systems as beacons. And that's certainly the way in which the NHS is seen around the world. So if you think about the 3 items that we've all talked about so far and how important they are around the world, you can understand what that actually means. So the first one, I think, is, I mean, it's always interesting to me to look back at 1948 and what happened there and the campaign around the setting up of the NHS. The strapline at that time was not better health or better care. There was some of that around, but that wasn't the main strapline. The main strapline was in place of fear. And that idea that when you become ill, that you don't necessarily have to worry about your financial circumstances, losing your house, bankruptcy of your business, all the sorts of things that many people across the world have to face. The idea of a system that takes away that fear is enormously important for a society and enormously important for a healthcare system. And one of the reasons that ours is held in such high esteem, both by our own people and around the world. Being free at the point of use, you don't have to, when you need treatment in this country, reach for your credit card. You don't have to show the documentation of the insurance coverage that you have. You don't have to show your bank balance in order to be treated. That's an enormous positive for countries thinking about improving their healthcare systems around the world. And we were one of the significant healthcare systems that can do that. And the final issue is the simplicity of our funding system. Now, it's very simple, our healthcare system: taxation, general taxation, the fairest way of taking money off the population, given to the healthcare system to deliver great care for patients. Now, one of the great benefits, well, is its simplicity that everyone can understand. And together with that, you can understand the accountability that goes along with it, is how efficient that is. In other systems, whether you're talking about social insurance or health or private insurance, it costs you between 15 and 20% of every pound, dollar, and euro that you spend on healthcare to administer that system, the way the money moves around the system, how you take it off businesses and organisations and people on the one hand, and how you then distribute it through the various funding mechanisms to your healthcare deliverers on the other. In the UK, it looks around between 2 and 3%, that equivalent cost, which is an enormous benefit. So if you think from a taxpayer point of view, you're getting 3 or 4 times the benefit through the simplicity of that system. But that's not enough. There are things about our system which genuinely people in almost any country you want to go around the world would contribute. The first one is primary care, and the second one is transparency. If you think about primary care, a population health-based local system with some of your most expert doctors available for the local community is something that most countries aspire to, but very few actually deliver the way in which we deliver primary care. I'm sure the next speaker on our side of the debate will have more to say on that. And it only goes to show how important that is, the way we support people with diabetes, the way in which we provide secondary prevention to all of those systems is a beacon throughout the world. We have literally world-class performance in this area, and that was and that performance was reflected in the vaccination programs that we said. Predominantly the vaccination program has been delivered through our primary care system, something which is really it's a jewel in the NHS, but it is a jewel that's seen throughout the world as being significant. And the second area is transparency. And I absolutely take the point that were made about some of the serious issues that we have to face as a healthcare system. The point I would make is that, first of all, we have far more data about what happens in our healthcare system, which is not driven by charging and financial systems, but actually is driven by population and clinical systems, that gives us unique insights into healthcare in a way that very few other healthcare systems in Europe or in the world have got. Indeed, in 2008, when we established high quality care for all, and interestingly, one of the things that we did, the research we did on that was to set out what is it that makes a really high performing clinical team. And the conclusion was not surprising at one level. It was they work really well together as a clinical team. But also they start measuring things. And when they start measuring things, they start giving themselves improvement goals. And when they start giving themselves improvement goals, they want to start comparing themselves with the performance of other clinical teams. And in that way, you create performance improvement. And we have a plethora of data around our system, not least of all in primary and community care, to enable people to do that. I mean, even in some of our most developed countries, when we were looking at the comparison, some of the stuff that the OECD uses, they actually don't have the scale and nature of the data that we have. They have smaller data sets covering smaller populations. They extrapolate across the country as a whole to get it. We have the real data, and that gives you an enormous platform on which to improve your services. I mean, one of the things I often say to people, and you're absolutely right, some of our performance on the way we treat our black and ethnic minority staff in the NHS is poor. But my challenge is always, can you just compare us with the healthcare systems then, how they do this sort of thing? And the answer is you can't, because they don't do it. We're the only healthcare system that collects some of this information in real time across a whole system. And that gives you enormous opportunities then to improve services going forward. And the final point that I would make, it's often said that the NHS is a kind of old-fashioned system, which is not fit for the future. I mean, one of the things I would say is that if you think about a future with precision medicine, genetics, genomics, all of those sorts of things, if you think in the future you'll be able to have your genome read, you'll be able to identify the risk factors for you as an individual about your healthcare going forward, about your potential. I think, what do you think is going to happen to the insurance industry around all of that and for individuals? I don't think there's an insurance industry in the world that would be able to tackle that kind of issues in a comprehensive way. So this whole free at the point of view, driven by general taxation, rather than being a look to the past, is actually sustainable and ready for the future. So I would, both from my own personal experience, from my experience working in other countries, absolutely say that the NHS is the envy of the world. And so I would support this motion.
So David, thank you so much. And thank you for the kind of generosity for which you're known, for being the person to jump on the grenade with being the person to forget about the muting. I'm sure the rest of the panelists are very grateful for that. And speaking of other panelists, I'd like to move on to Matthew Lesh to continue the case for the opposition.
Thank you very much. It's truly an honour to speak at the Oxford Union today, and I do congratulate you, James, and your entire committee on putting together this debate and so many other, an extraordinary line of events in such difficult times. Alex is, or at least was, a dentist in Cambridge. His specialty was dental forensics, supporting law enforcement, tackling gruesome crimes and ensuring justice was served. Last March, Alex was tragically diagnosed with an aggressive bowel cancer and prescribed chemotherapy. That wasn't something he was looking forward to do, but he was determined to do. Then COVID-19 arrived on Britain's shores. The NHS cancelled his potentially life-saving cancer treatment. His condition rapidly deteriorated and it placed him in excruciating agony. His wife, a nurse, spent 2 days trying to get painkillers to alleviate the suffering. But sadly, the NHS was not responsive and she was unsuccessful. The next day, Alex died. Alex's story is one of many thousands. Denied care by a system that too often fails to treat patients as individuals entitled to attention. A system that has showed vain indifference to Andrew's suffering in the final days of his life. My remarks today are going to focus on how the NHS's deep flaws have been exposed by the COVID-19 pandemic. To be clear, I do not believe the NHS is exclusively responsible for the UK's immense COVID-19 death toll, but nor is it free from blame. There have been a number of cascading governance failures, and some of them are very much entwined with the NHS and the nature of that system. But at the same time, I do not want this to be taken as an indictment of NHS doctors, nurses, and support staff. In fact, I believe the NHS staff have been very much undermined by the inhumane bureaucracy in which they work. A system that struggled to provide them personal protective equipment, a system that instructed doctors against their better instincts to discharge patients to care homes without being tested, a system that forced them not to treat patients in need. The COVID-19 pandemic arrived on British shores unobstructed in no small part because of Public Health England's restrictive, bureaucratic, and highly centralised process to arrange testing and tracing. Public Health England refused to include universities or even animal testing labs, and certainly not private companies, because of the we know best centralising instinct. Now, if we look at how other countries have handled this, it was dramatically different, with far more decentralised healthcare systems that are far more centred on patients and far more competitive in places like Germany or South Korea. They managed to ramp up testing using the private sector, using various labs, and consequently had substantially lower death tolls. The PHE is, of course, not the NHS, but it exists in the same highly centralised, monopolistic, one-provider structure of the NHS. It is, in fact, a bit of a parallel to the NHS, undermined by the same flaws on display throughout the UK's healthcare system. Now, as has already been said, this cannot just be put down to funding. The PHE had increased money on infectious diseases in the same way the NHS has seen funding boosts. But at the same time, we can see countries that spend a lot less on healthcare, countries like Taiwan or Singapore, tend to get much better outcomes, both in terms of their pandemic response, but also in terms of their general healthcare outcomes. The central flaw of the NHS is, quite frankly, that it's a monopoly. Decisions about how to spend resources are made centrally, based generally on what middle management thinks is best, rather than in a feedback mechanism based upon what patients need. There is often a lack of feedback mechanisms to ensure good outcomes. As a result, we saw many deadly mistakes during the pandemic. The focus on protecting the NHS, a political demand to avoid television screens showing hallways full of patients, akin to Wuhan or Lombardy, led to mammoth efforts to discharge patients and reduce other services. The focus became COVID, but at the expense of everything else, because that's what the bureaucracy told doctors, nurses, and hospitals to do. Well, of course, some of this was necessary to deal with the pandemic pressures. It had many perverse consequences and was not always clearly necessary. Guidance was issued last March, instructing doctors to discharge patients to care homes. That resulted in 25,000 patients from hospitals being sent to care homes before the guidance was changed in mid-April. Now, that means we sent the people who are most vulnerable from somewhere they are most likely to come across COVID-19 in hospitals back to care homes to potentially infect and spark outbreaks amongst other vulnerable and elderly people. And no doubt a key reason why we've seen tens of thousands of people die in care homes. Now, while fewer people might have died in hospitals, that's no consolation prize for those who lost their loved ones elsewhere. In an even more maddening decision, this guidance was again issued last month that stated that it would be acceptable to discharge patients to care homes without tests. Another example here is the Nightingale hospitals. But while these have been widely celebrated, thousands of beds in a convention centre does not actually make a hospital. These were very rarely used throughout the pandemic. And the questionable decision to focus so much resource on these new facilities that very much could not be staffed because of the existing shortages of the NHS of doctors and nurses provided a mirage rather than actually providing a helpful service. Now, while many are going to interpose that this was government guidance or that these were government decisions, I think it's very hard to separate the government from the NHS. They work in tandem. And indeed, something like the NHS's pandemic strategy was very much focused on discharging patients. So it is very much fundamental to the way the NHS operates. Now, we also saw the system leave people to potentially die at home with COVID-19 in order to ration hospital beds. There was an effective admission of this when that people were not getting the care they required when London ambulances lowered their threshold for admission on April 10. Resources were also freed up by stopping routine appointments, cancelling much needed treatment, and the protecting the NHS slogan scaring many people away from emergency rooms. Millions of surgeries were cancelled, each month last year, and thousands of cancers were missed each week as referrals declined by 3/4. There are now mammoth backlogs with millions of people waiting for diagnostics and treatment. Tragically, it doesn't actually appear all this denial of care was necessary. By mid-April, according to the Health Service General, NHS hospitals had 4 times more spare bed capacity than usual. Perhaps in a less top-down system, some of this capacity could have been used to treat those in need. In another case of waste, the NHS also bulk purchased private hospital capacity, costing the taxpayer £400 million per month. However, last summer, 2/3 of that private capacity wasn't even being used. So bureaucratic incompetence meant that the huge backlogs were not addressed when the pandemic ebbed over the summer. Now, this was in fact celebrated by the system. An NHS spokesman said last April that the spare beds was proof of continuing success in ensuring we have available capacity. Now, quite frankly, I think it's pretty disgusting to celebrate having empty beds while many are denied life-saving cancer treatments and struggling from pain from knees and joints because they can't have surgeries and waiting many months, if not years, for the treatment that they need. Underlying this is the fact that the system lacks choice and competition. For those people who are denied care, they have no alternative unless they have large amounts of money to go to the private system. Now, the contrast with going to a vet could not be starker. If you walk into a vet, you're seen on the same day and tend to get treatment straight away. Even at the best of times, even outside of a pandemic, the NHS makes you wait for weeks, if not months, to get care. The vaccine rollout here is a prime example of the results of choice and competition. Well, thanks to the hard work of Kate Bingham sidestepping the usual NHS procurement process, the UK has a very strong program. It is actually not leading the world. About 15% of Brits have been vaccinated compared to over 60% of Israelis. Notably, Israel also provides universal taxpayer-funded healthcare, but Israelis have a choice of 4 different healthcare funds that are competing to vaccinate people and more generally provide high-quality care and also gather the same kind of extensive data over time. Now, this is kind of economics 101. Efficiency is improved by competition. It's not improved by a monopolistic system that, whilst sometimes and often providing excellent care, often does not. Now, the NHS was put under extraordinary pressure over the last 12 months, and it has done often exceptionally well with dispensing some of the usual bureaucratic red tape. But even this, I think, raises some questions. If normal processes prevent innovation improving patient care, why are these issues not solved by the system during normal times? The NHS pandemic struggles speak to a deeper truth. Despite decades of reform, there has been little success in developing a healthcare system that is patient-centric rather than focused on resource management. Now, there are plenty of people across the world who love Britain. They love the Queen, they love the history, and they love the culture. I don't think anyone has ever bumped into a Canadian or an Australian or a German or a Norwegian who has said, "I envy your NHS." The NHS is sometimes excellent, it's sometimes terrible. Now, my remarks today are not intended to be malicious. Rather, I believe by highlighting the flaws and understanding their causes, by putting aside the fantasy that the NHS is the envy of the world, that it is possible to improve the system. We owe it to Alex and the thousands more like him to do better. And that's why I urge you to oppose this motion.
Matthew, thank you very much for that. And thank you as well for waking up so early. This is a doubly good advert for you if you look this good at 6 a.m. It's a wonderful advert. Thank you very much. I'd now like to ask Dr. Amir Khan to close the case for the proposition.
Hi, thank you for having me. It's been a brilliant evening so far. And I'm hoping to swing anyone who's thinking, oh, I'm not quite sure we're going to swing towards the NHS. Look, I'm a GP. I'll be honest with you. I'm a full-time NHS GP. I do a few other bits on the side, but my main job is to see patients. That is my main job. I see them at the surgery. I see them at home. I go to care homes to see them. I am in there with the NHS. And I want to start off by saying we have the worst COVID death rate in the world. And that might be an interesting way to kind of start off a debate when I'm, for the NHS. But that number, that over 100,000 number is not because of the NHS. It's because of public health policy. It's because of the current government, slow lockdowns, test and trace, all of those usual things. But once the NHS got their hands on something, and I'm talking things like management of critical care patients, introduction of dexamethasone, all of these kind of things. But now the vaccine in particular, and I am heavily involved in this. You know, I work in Bradford, an inner city kind of socially deprived part of Bradford as well. But I've been involved in the decision making. You know, we heard from the last honourable speaker that these decisions are actually made centrally. That's nonsense. They are not made centrally. We make these decisions at a local level, something called clinical commissioning groups, something called primary care networks, which are made up of local doctors, local healthcare professionals, lay people, members of the public, who decide which services their population in that area need. And this is how we make our clinical decisions. This is how we provide service to our patients. If you centralize that, if you take that away from us, the people who are in there, it will all go horribly wrong. But that is how the NHS is run. It is run on a local level more than anything. Let's go back to this vaccination program. So we've set up these clinics. We have got patients in. I've been out to nursing homes to vaccinate those people there. They are incredibly happy to receive these vaccines. And actually, we are right now looking at our vaccination numbers, 10 million plus. We are right now the envy of the world. There's jaws dropping all across Europe, political jaws dropping all across Europe, looking at how well we are vaccinating. So if the question is, are we the envy of the world right now? The answer is yes. But I'm going to talk to you a little bit more about kind of what that envy means, because people before me have talked about, oh, well, Germany are not envious of us, Austria are not envious of us, the political leaders. I'm not really interested in that. I want to know about my patients and what patients in those countries are maybe envious of, or look to us and say, oh, how can you do that? My patients don't have to pay to see me. They ring up in the morning, or they make an appointment, and they're not waiting weeks or months like someone suggested prior to me speaking now. They can see me on the day. I went into work this morning, patients rang up this morning, acutely unwell, and I saw them in my surgery. You know, we talk about waiting times, and yes, there are waiting times across the NHS, but if you are acutely unwell, you go to A&E or you see your GP, and those waiting times are, you know, we will see you on that day. So it's really important that we get that out there. Now, look, I understand. I've read all the reports about our outcomes, our health outcomes, particularly with cancer, heart disease, stroke, and I know we can do better. We need to do better, and it goes back to some of that transparency. However, we've got to be very mindful that the NHS is not solely responsible for these outcomes. A lot of health is due to social deprivation, around economics. That has nothing to do with the NHS. As I said earlier, I'm very open about this. You know, I work in a very, very socially deprived area. When I go into people's homes to visit them, as I did today, often they don't have carpets, they don't have basic amenities, and that in itself lends itself to poor health. That's not the fault of the NHS. It's not the NHS's fault that these people don't have these basic needs. And this lack of basic needs, these chaotic lives these people live, this socially deprived life people live, lend themselves to things like obesity, smoking, alcohol dependence, drug dependence. I see it every day. You know, I'm the only person on this panel who actually deals with patients on a day-to-day basis. And I can be completely honest with you, the truth of that is really, really hard. And it comes home with me every night, and it is tough to see, but we go and do it. And to say that actually those heart disease outcomes are because the NHS isn't good enough. A lot of cancers can be linked back to obesity and lifestyle choices. I don't like to use that word. Actually, they're not lifestyle choices. A lot of these people are forced into these lifestyles because of the social sector and the lack of support that people get. And that will cause our health outcomes to spiral downwards. But we mustn't just focus on those negatives. We've heard lots of individual stories from the opposition about how individual cases went wrong, but we never ever talk about the hundreds and thousands of cases that do really well. My patients, you know, I've got a number of stories where patients have during the pandemic come and see me with symptoms that may be cancer. I've referred them under the 2-week urgent referral pathway. They've been seen within that 2 weeks by secondary care and received treatment all through this pandemic. But we're not talking about them. We're not looking at those people. We're always talking about, you know, what can be done better, which is important, but it can't be the only thing we talk about. And remember, poverty and poor health go hand in hand, and the NHS is often picking up the pieces for poverty and the outcomes that actually has. And there are some positives when we looked at some of those outcome measures. I'm a specialist in type 2 diabetes, injectable therapies, that kind of thing. And actually, when you look at type 2 diabetes, or diabetes in particular, the primary care outcomes are fantastic. If you compare us to Germany and Austria, actually, the number of patients that we see in hospital as a result of complications from their diabetes is about 1 in 1,000. Compared to those countries, it's 2 in 1,000. So, you know, you might well focus on some of the aspects, but you've got to be clear, this is a very, very broad picture. Now, look, I want to try and give you a real honest view of what it's like to be poor and what it's like not to be able to afford healthcare. I know the arguments may well be, well, you know, people who can't afford healthcare will still get free healthcare, even on an insurance-based policy. It'll all be means tested, all of that stuff. But actually, if you look at France, for example, and you look at what income levels are needed before they start paying into their healthcare systems, it is really, really low. A 4-person household in France, if their threshold income is just over 18,000 euros, they have to pay about 7% of their gross salary towards healthcare. 18,000 euros for a 4-person household, that's next to nothing. And I can speak from personal experience. I grew up, you know, in a very working class family, and I did need healthcare. My family did need healthcare, and we were so grateful it was free at the point of delivery. My patients now are in exactly the same position. I want to speak on behalf of the other NHS staff as well. Many of us are in this job, including myself, and I'm hoping many more to come, because the healthcare is free at the point of access. I've done voluntary work in Malawi. I have seen what it's like when people can't afford health. I've seen what it looks like. I've done mobile clinics out in very remote villages. I've seen how poorly they can get because they're unable to afford healthcare. They can't afford blood donation for blood, for example, and that has led to really poor health outcomes. I'm not comparing the two, but I just want to make that stark kind of reality clear. When you're poor, life is hard, and a lot of Britain is poor. A lot of Britain lives in poverty. They can't afford what everybody here is suggesting, and I just think that's really important. I want to go back to a couple of other points, really. I'm from a BAME background, again, same as a person was talking about before, and I understand the discrimination that is faced across the NHS by being from a BAME background. I also understand that the NHS is now starting to recognise that problem and going to measures to try and improve it. And it's not exclusive to the NHS. You know, we must think about these issues, you know, broadly. BAME discrimination is not exclusive to the NHS. It runs through many other organisations. So you can't use that as an argument to isolate the NHS in terms of envy. I'm going to finish off, actually, because I could get very passionate and very emotional about this. So I'm going to finish off and say, look, I understand that the NHS needs a facelift. It does need a facelift, but it still remains the envy of the world. When you talk to the people of the world, the people who can't quite get their head around it, saying, what, you mean you go and see the doctor and you don't have to pay, you don't have to show them any papers for insurance, you don't have to do any of that stuff. The number of conversations I've had with people across the world who can't quite grasp that idea, the idea of primary care, going to see a primary care physician on the day for your gynae problem, for your breast lump, for your heart disease, for your diabetes, that just doesn't really exist in the way it does here. They often have to go and see specialists, and there's a waiting time and there's a cost. This whole structure of the NHS, the people within the NHS, is really the envy of the world. And I can say that as someone who works in the NHS.
Dr. Khan, thank you very much indeed. You may have tweeted an hour or so ago that you were very nervous, but you've done Bradford and your whole side proud. So thank you very much for joining us.
Thank you.
I'd now like to ask Kate Andrews to conclude the case for the opposition and for the entire debate. Thank you, Kate.
Well, thank you, Mr. President. I would have started tonight by addressing the examples we've heard from the proposition about which countries have publicly put on the record that they envy the NHS and why. But my tally was approximately 0, which I find slightly odd when defending the motion that the NHS is the envy of the world. You might expect to hear an example from perhaps a poorer country, developing country even, about why they might envy the NHS, but we heard nothing tonight. So instead, I'm going to use that time to address the boogeyman on the call. And then I'm going to sum up the opposition's arguments by making 3 points against the motion tonight. I'm from the United States of America, which is the boogeyman on the Zoom call. It is not a health system you want to import. I can confirm that. It is prohibitively expensive, it's bureaucratic, and it's flawed in many, many ways. As many of our other speakers have pointed out tonight, on the opposition side, it is the biggest outlier you're going to find in the developed world. You cannot meaningfully compare it to the NHS. It is essentially the only developed country not to provide universal access to healthcare. So when we talk about the poor, the vulnerable, those who would struggle to get access to care if they had to pay, they are provided for. Frankly, not in America, but pretty much in every other developed country. So this concept of universal access to care is by no means unique anymore. It's a baseline. So it's going to take a lot more than that to convince our audience tonight, I think, that that should classify you as the envy of the world. So on to my 3 points. First, I say there was broad agreement tonight, indeed from most of the proposition this was wholly embraced, that the NHS is one of the most centralized systems of healthcare in the developed world. Certain decisions are made locally, but international comparisons show how centralized it is. The Commonwealth study praises this, not healthcare outcomes, but how centralized it is. And the proposition confirmed in its defense of the NHS, primarily using vaccines and vaccine rollout as its example, that the NHS is completely embedded in government. So what is this government, this country's record of the pandemic? Let's call it mixed. You've heard many accounts from the opposition tonight about what's gone badly wrong, mainly from Matthew, discharging the elderly into care homes without so much as a COVID test, high levels of transmission of COVID in hospitals. And we are also learning what's gone well, the truly remarkable success of the vaccine procurement and rollout. So it's a mixed bag, and it's all in the same bag. You cannot separate the failures that were the failures of politicians and the triumphs and claim that they were the NHS's. It is not possible to say the failures belong to government, the triumphs belong to the NHS. On these accounts, you cannot separate the two. You can certainly praise the doctors and the nurses who have worked themselves to the bone this past year in a system that hasn't been fit for purpose for decades. You can criticize orders from on high that force doctors and nurses to go against their fundamental nature and deny patients seeking care that care some of the time. But you cannot separate the government from the NHS when it suits your argument, not during this pandemic, not ever. Healthcare and politics goes hand in hand in the UK, and politicians from every single party have made sure of that. And that brings me on to my second point. This universal agreement we have politically that the NHS is the envy of the world should signal to us that something has gone very badly wrong. If I were to ask you who said it, Jeremy Corbyn, or if I may be so bold, Jeremy Hunt, on a range of policy topics, from tax brackets to industrial strategy, you would have a pretty good chance of guessing right. But on the NHS, best of luck to you. Adornment, praise, envy of the world, it all blurs together. And I shouldn't be so unfair as to single out the Right Honourable Jeremy Hunt. The Prime Minister is one of the worst culprits when it comes to NHS worship. Leaders across the political spectrum mark the institution's birthday. You don't need gimmicks like that if the results are speaking for themselves. If you vote Conservative, Labour, Green, Liberal Democrat, you aren't choosing between different healthcare policies. Nobody is offering you the critical analysis or international comparisons that you heard here from the opposition tonight. At the very best, you're choosing between different amounts of money being funneled in a never-ending game to outbid your opponent. with no real consideration about where that money is actually being funneled to. Perhaps you're choosing between email lists in which politicians will write to you and say why they really love the NHS more than the other guy or gal. And this should make us skeptical, to say the least, that this universal rose-tinted view is creating something that would be envied elsewhere, that there's no debate in this country about how to improve this system. This doesn't take place in British politics. And because it doesn't take place, you get the abysmal outcomes as detailed by Daniel, Christian, and Matthew tonight, mediocre to bad results for very common and serious illness. Nothing can be or will be the envy of the world if it's not robustly scrutinized, criticized, and improved. And this, frankly, hasn't happened for decades. And this brings me on to my third and final point. Never in living memory have we thought so much as a collective about life and death. And that, when we boil it down, is what healthcare policy is. It is a matter of life and death. We have all canceled our plans, uprooted our routines, and stayed at home to protect strangers that we have never met, and we will probably never meet. And we've done this because we deeply care in this country, it turns out, about the value of life. And that is a wonderful thing. So if there were ever a time to have this conversation, ever a moment for real sober analysis of healthcare in this country, this is it. This is the time that we think about the value of the lives of countless patients who have gone overlooked for many, many years in the name of political theater, frankly, in the name of ego. The tens of thousands of cancer patients that would be saved each year if treated in neighboring countries, the mothers and the babies experiencing the realities of failing maternity wards, the people who are waiting months to access treatment long before the pandemic hit. And we also need to think about those who are waiting now. We heard from the proposition tonight that everybody who has needed access to healthcare during this pandemic has gotten it. That's true for COVID patients. As Matthew pointed out in his speech, that isn't true for the 4 million people on a waiting list now. Somebody always pays the price for rationing, and that is what the NHS fundamentally is, a rationing system. And I fear we're going to hear many more of those tragic stories and those who are paying the price for rationing in years to come. Apart from hearing about the USA tonight, the main argument that I took away from the proposition seemed to be on the principle on which the NHS was built, and that's universal access to healthcare. It is true that this principle influenced many parts of the world, but what happened after that was they stormed ahead. They took a rational approach to their healthcare systems, they scrutinized it, they made different decisions they developed when the NHS lagged behind. It requires going back to the 1940s to think about a time that the NHS was envied. It's 2021. And if we keep looking so far backwards, we're going to continue to fail the patients of the future. And I think we need to do better. So let's start tonight by acknowledging that the NHS is not the envy of the world. And let's build up from there. Thank you.
Kate, thank you very much indeed for wrapping up the case for the opposition and for the debate in total. And I'm glad to see that for the first time in a while, I've seen you not wearing your Reagan Bush 84 jumper. And we can now say that it's 33% of people think the NHS is the envy of the world, and 67% say that it's not. So the dial has moved a good 5%, but in a shock move, it seems that the majority of people this evening do not think the NHS is the envy of the world. All that's left for me to do is to thank everybody on this panel on both sides. And from all of us here at the Oxford Union, thank you very much for tuning in. We'll see you at all of our future events. And with that, I remain James Price, Worcester College, and your president.